Hello, my name is Eric Peterson, and I chose to research the drug Pulmozyme. Um, Pulmozyme is an inhaled medication used to treat the symptoms of cystic fibrosis, which is also known as CF. It helps thin the mucus in the lungs so people can cough it out more easily. It is also called recombinant human DNase or Dornase alpha. It is taken by an inhaler typically once a day, and it also can be taken twice a day. Pulmozyme was approved by the U.S. Food and Drug Administration, the FDA, in 1993 and is the first drug developed specifically for CF. What is Pulmozyme used for? It's used to treat people with cystic fibrosis and improve lung function in people with CF. CF is a hereditary disorder. In people with CF, a defective gene and its protein product cause the body to produce abnormally thick mucus, which leads to the blockage of the pancreatic ducts, intestines, and bronchi and often results in respiratory infection. It obstructs the pancreas and stops natural enzymes from helping the body break down food and absorb vital nutrients. In other words, it clogs the lungs with thick mucus and leads to life-threatening lung infections. CF affects roughly 70,000 children and adults worldwide. 30,000 of those people are in the U.S. Today, the average lifespan for patients with CF is 30 years, compared to 14 years in 1969. So, who produces Pulmozyme? Genentech Incorporated produces Pulmozyme. Venture capitalist Robert Swanson and biochemist Dr. Herbert Boyer founded Genentech on April 7, 1976. Genentech is committed to people having access to their medicines. Genentech Access Solutions is a team of 350 Genentech employees who help those who need Genentech medicines. This team works with patients and doctors to resolve reimbursement and insurance issues and provides assistance to eligible patients in the U.S. who do not have insurance coverage or who cannot afford their out-of-pocket copay costs. In 2011, Genentech helped more than 100,000 fully insured, underinsured, and uninsured patients with access issues. They have supported copay assistance foundations with more than $725 million in donations since 2005. Since 1985, when its first product was approved, Genentech has donated $2.85 billion in free medicine through Genentech Access to Care Foundation and other product donation programs. Some miscellaneous stuff about Genentech. It was named to Fortune's 100 Best Companies to Work For list for the 16th year in a row. They are regularly recognized as leaders in the biotechnology industry. They have 35 medicines on the market. They have roughly 13.3 thousand employees working to solve unmet medicinal needs. Genentech conducts basic and applied research in the areas of oncology, immunology, neuroscience, metabolism, and infectious disease. How does Pulmozyme work? Basically, it acts like scissors in the mucus. It cuts up the DNA strands outside the cell that can make CF mucus thick and sticky. This DNA is from the white blood cells that work to fight lung infections. Even if a person with CF has not had a lung infection, the white blood cell DNA is still in the mucus. And I'm going to show a quick, short video about how Pulmozyme works.
Now an introduction to Pulmozyme. Pulmozyme is an essential partner in the fight against CF and uniquely targets one of the causes of thick and sticky mucus. Laboratory studies have shown that Pulmozyme uniquely cuts apart extracellular DNA by acting like an enzyme found naturally in the body, which helps loosen and thin the thick and sticky mucus.
So there's that. How Pulmozyme is produced. So let's just begin at the start. In March of 1988, when Genentech researcher Dr. Stephen Shack was observing the blood-thinning drug known as TPA as it dissolved blood clots, and developed the idea to engineer an enzyme that would dissolve mucus plugs in the lungs of CF patients. Research from the 1950s suggested to him that DNase isolated from cows had been effective in breaking up mucus, though its use was discontinued because patients had allergic reactions. October of 1988, Dr. Shack successfully isolated the human gene for DNase and cloned a small amount in the lab. Tests show that the cloned DNase did break down DNA accumulations in CF sputum. He assembled a team of 25 people to develop the drug. In 1989, the DNase team began to purify large amounts of the enzyme. Dr. Shack spoke to CFRI about the development process and results to date, and then Genentech had to get FDA approval, and after that they did their testing of the drug, which we will get to later, and then they were allowed to sell Pulmozyme in December of 1993. So, how is Pulmozyme produced through genetic engineering? The protein is produced by genetically engineered Chinese hamster ovary cells containing DNA encoding for the native human protein, deoxyribonuclease 1, also known as DNase. Fermentation is carried out in a nutrient medium containing the antibiotic gentamicin. However, the presence of the antibiotic is not detectable in the final product. The product is purified by tangential flow filtration and column chromatography. The purified glycoprotein contains 260 amino acids with an approximate molecular weight of 37,000 daltons. The primary amino acid sequence is identical to that of the native human enzyme. So the big part is the Chinese hamster ovary cells, which is what makes Pulmozyme work. That's the recombinant DNA. So testing of Pulmozyme, the clinical experience of it. Pulmozyme has been evaluated in a randomized placebo-controlled trial of clinically stable cystic fibrosis patients 5 years of age and older with baseline forced vital capacity FVC greater than or equal to 40,000 of predicted and receiving standard therapies for cystic fibrosis. Patients were treated with a placebo, which was 325 patients. 322 patients were treated with 2.5 milligrams of Pulmozyme once a day, and then 2.5 milligrams of Pulmozyme twice a day went to 321 patients. This went on for 6 months and was administered via Hudson T Updraft 2 nebulizer with a Pulmoaid compressor. So here is one of the tables from the clinical study trial. Both doses of Pulmozyme resulted in significant reductions when compared with the placebo group in the number of patients experiencing respiratory tract infections requiring the use of parenteral antibiotics. Administration of Pulmozyme reduced the relative risk of developing a respiratory tract infection by 27% and 29% for the 2.5 milligram daily dose and the 2.5 milligram twice daily dose, respectively. And you can see that in Table 1 here. The data suggests that the effects of Pulmozyme on respiratory tract infections in older patients, which is greater than 21 years of age, may be smaller than in younger patients, and that twice daily dosing may be required in the older patients. Patients with baseline FVC, which is greater than 85%, may also benefit from twice a day dosing, which is again seen in Table 1. The reduced risk of respiratory infection observed in Pulmozyme treated patients did not directly correlate with improvement in FEV1 during the initial 2 weeks of therapy. Within 8 days of the start of treatment with Pulmozyme, mean FEV1 increased 7.9% in those treated with once a day and 9.0% in those treated twice a day compared to the baseline values. The overall mean FEV1 during long-term therapy increased 5.8% from baseline at the 2.5 milligram daily dose level and 5.6% from baseline at the 2.5 milligram twice daily dose level. Placebo recipients did not show significant mean changes in pulmonary function testing. For patients 5 years of age or older with baseline FVC greater than or equal to 40%, administration of Pulmozyme decreased the incidence of occurrence of first respiratory tract infection requiring parenteral antibiotics and improved the mean of FEV1 regardless of age or baseline FVC. Also, the clinical trials have indicated that Pulmozyme can be effectively and safely used in conjunction with standard cystic fibrosis therapies. These therapies include oral, inhaled, and/or parenteral antibiotics, bronchodilators, enzyme supplements, vitamins, oral or inhaled corticosteroids, and analgesics. That's just the same graph, a little more colorful. So, what are some side effects of Pulmozyme? Some of the more rare ones are hives or welts, itching, redness of skin or skin rash, and then some more common ones are chest pain or discomfort, hoarseness, sore throat, and then some of the more less common ones are difficulty breathing, fever, redness, itching, pain, swelling, or other irritation of eyes, runny or stuffy nose, and upset stomach. These are really the only issues that come from Pulmozyme. There have been no major harmful events from patients using Pulmozyme, and it is clinically proven and FDA approved safe to use. So some ethical moral issues, not very many, but of course the side effects of Pulmozyme, you got to mention those. But those are really the only things that may be of concern for issues related to Pulmozyme, as far as allergic reactions if someone taking Pulmozyme. And then also, I mean, there's a good side to being sick. Most people these days work hard, are under pressure, and think they don't have time to take sick days. But when they are sick, this is their sanction time. So some may not want to take their regular dose of Pulmozyme for this reason. And then also, of course, people who are against recombinant DNA technology and genetically engineered products may raise ethical concerns pertaining to Pulmozyme. I have not came across any articles that are against the use of Pulmozyme due to any ethical issues of the drug. So as I mentioned earlier, it's a safe drug, not very many issues have rose from it. So some competing companies and drugs, more specifically drugs. One of them is hypertonic saline, which represents a cost-effective option of clearing sputum from the lungs of cystic fibrosis patients. Inhaled hypertonic saline is one of the newer treatment options for CF. A group of Australian researchers discovered the benefits of hypertonic saline when they noticed that surfers with CF had better outcomes than people with CF who did not surf. The researchers believe that inhaling the salty mist of ocean water during surfing was the reason that surfers had less respiratory flare-ups than their non-surfing counterparts had, and the study confirmed those findings. The researchers published the results of their study in 2006, and since then, hypertonic saline has been available as a treatment option to many people with CF. And then probably the main competitor is Tobai, which is an inhaled antibiotic for the treatment of cystic fibrosis. Tobai helps fight the germ Pseudomonas aeruginosa, which is a leading cause of chronic lung infections among people with CF. In people with CF, taking Tobai twice a day has been shown to improve lung function, decrease the number of days spent in the hospital, and reduce the need for IV antibiotics. And then here are some therapies that go along with Pulmozyme. So some antibiotics, they help to prevent and treat infections. Bronchodilators, they help to relax the air wall lining. Hydrators help to restore airway surface liquid, and airway clearance techniques, which help physically loosen and move mucus out of the way. So the marketing and the sale of Pulmozyme. This drug is being sold at $27 per 2.5 milligram ampoule, which is the recommended daily dose. Its annual cost of $9,855 is still considered cheaper than a typical hospital admission. Pulmozyme is also expected to be covered by both private and government insurance plans. So how do they market Pulmozyme? Life can be tough for kids who have CF. People with CF typically start taking Pulmozyme when they're around age 6. So these are some pictures from ads with Pulmozyme. You know, they're showing kids being normal kids, which can attract parents to using Pulmozyme because they want their kids to be normal. So these pictures show that if you take Pulmozyme, your kid will be able to do normal kid stuff. And then some historical sales. Here's a graph here that shows the Pulmozyme sales total from 1994 to 2008. And as you can see, there's been a significant increase of sales throughout the year. Now, Pulmozyme, as shown here in 2008, racked up $305 million. So that covers that presentation for Pulmozyme. Hope you enjoyed it. A little nervous talking. Started a little bit, but yeah, enjoy.